Now, as I mentioned previously, there are benefits to being out in the sun. We all need sun exposure to some degree to be able to have vitamin D develop in our skin. We need vitamin D to help with calcium and phosphorus absorption, to help build strong bones and reduce the likelihood of developing osteopenia or osteoporosis. However, this is an area that is still being studied, and there is no across the board recommendations for everyone on how much is enough sun exposure. Part of that is, again, you have to think about the UV index depending on your location, your altitude in the atmosphere, the time of year and the Earth's axis, as well as your particular skin situation. Depending on how much melanin or pigment that you have in your skin is going to really determine which amount of vitamin D sun exposure requirements you particularly are going to need. At this time, the World Health Organization does have a recommendation of between 5 and 15 minutes, 2 to 3 times a week for most individuals. But again, this is an area that is still being studied, and we do not know how much is the right amount for every individual at this point to be able to give recommendations based off of UV index, location, or skin types. And again, there are conditions that we do recommend UV exposure for medical indications. Again, this is an area that's going to be prescriptive from your provider. They're going to have a very specific treatment plan. And usually those are going to be conditions such as psoriasis, eczema, certain types of acne, rickets, vitiligo, and then certain cases of lupus. So across the board, there are not medical recommendations for having high levels of UV exposure. If we do recommend it, it is in a very specific treatment plan for specific conditions. So don't just think that that gives you carte blanche to be out in the sunlight all the time and without being protected. So I hope this has been helpful. And we want you to be able to be outdoors, have fun, but stay safe, reduce your risk of skin cancers from UV radiation exposure as well as the other side effects to your eyes, and try to have an active and healthy and productive life by getting outdoors and not just hiding inside all the time. And until next time, this is Dr. Radley, family physician in St. George, Utah. Pura Vida.